Intraocular pressure from snapshot to movie. It seems to fit into the new internet look. Hello, Jay Katz.
Thank you, George, and thank you, everyone, for attending. I thought the last talk here, we should kind of look a little bit into the future, and I think it's an exciting one. You've heard some of the earlier talks about intraocular pressure being such an important part of glaucoma, and it is. It's used to help diagnose glaucoma, evaluate the treatment of glaucoma, and hopefully predict the stability of glaucoma if the pressure is lowered adequately. If you've been a patient, you realize that the doctors measure your pressure for a split second, and you've heard that the pressure may vary during the course of the day. But we make a decision based on that one short measurement often in the office when you see the doctor. The question is, can we get more information, and can we do it in an easier fashion? So, yes, pressure is very important. We want to get more information, and how do we do that? You got to remember that during the course of the day, your pressures are going up and down, and it may depend on what you're doing at the time. So, for example, if you're an advocate of yoga or hanging upside down, we know the pressures go up tremendously during the time you're inverted. If you happen to play a wind instrument, we know the pressures through some studies, the pressures can go up tremendously during that period. Does that impact on you as a patient? We really don't know the answers to that because it really hasn't been studied. But our concern is that the pressures may be undetected and we may not be finding out dangerous levels of pressure at different times of the day. Now, are there ways of getting more information about pressure? And your doctor may, for example, say, why don't you just come in for a day and we'll check your pressure from morning to afternoon at different times, so we'll get 4 or 5 measurements to give us a sense of how it fluctuates over the course of the day. We'll find out what the highest pressure is, for example. Some people have taken that a step further, and they've even set up sleep laboratories where you actually go in, have the pressures taken at different times throughout the day, you sleep there, they wake you up in the middle of the night and check your pressures throughout the night. So there's a true 24-hour curve of the pressure that's determined. There have been a number of companies that have tried to develop tonometers, instruments to measure the pressure that you could safely use at home. That would be great. You know, if you can check your own pressure at home, that would give us a lot of information. But the problem with these tonometers to date have been that either they're inaccurate, they're just not close enough to reality, or they're potentially dangerous to use at home. So, for example, if you use a contact instrument, something that actually has to touch the eye, that's uncomfortable. And if you use an anesthetic at home, well, then you can predispose the eye to getting infections and ulcers, and that's not safe. So we really haven't gone very far with kind of you checking with an instrument at home as a practical tool. What seems to be actually much more likely to develop in the very near future is the use of telemetry. So this is a way of checking your pressure without you having to do very much at home yourself. Just showing you here, this is actually a sleep laboratory printout of various patients that are sitting, then they lie down, and then they're sitting again during the course of a 24-hour period. You'll see that when patients are sitting, like you would in the doctor's office, the pressures are definitely lower when the patients are lying down when they're asleep, and that's true for most people. Do your doctors check your pressure lying down? In general, we don't. All these studies to date in determining how we should treat you have been based really on sitting intraocular pressures. But what about the pressures when we're lying down and they're higher? What do we do with that information? We haven't collected enough to really know what to do with it yet. We know that the pressure is incredibly important in terms of diagnosis. So the higher the pressure when you're in the office, the higher the chances that you have glaucoma. And there are many studies that show that. So if you have a pressure of 12, you're much, much less likely to have glaucoma than if you have a pressure of 30. And when you're looking at controlling the disease, and this is one large study done over a period of 8 years, and during this 8-year period, if your pressures are really kept super low, those patients had very stable vision over that 8 years. And if the pressures weren't kept down consistently over that 8-year period and controlled to varying degrees, you had varying degrees of loss of vision. So the higher the pressure was, the more likely it was that you were going to lose vision. So again, getting the pressure measurement, the highest level, but also maybe the fluctuation of pressure is going to be crucial. There are some studies out there that suggest that, yes, it's important to know what the highest pressure is, but also how much fluctuation there is over the course of the day or even over a long period of time. This study suggested that if you fluctuated more than 3 points on average during the course of the day or long term, you're more likely to progress from glaucoma than the group that had pressures that were fluctuating less than 3 millimeters. So there's a lot here that we are still learning about, and if this is true, the fluctuation of pressure is also going to be critical in determining the efficacy of your treatment for glaucoma. Now, the instruments that you're familiar with for checking pressure are the blue light instrument. That's referred to as Goldman, named after Dr. Goldman, who developed the instrument, applanation tonometry. So tonometry is the measurement of pressure, and applanation is the technique or the principle it uses to measure it. The tonal pen is the handheld device because the Goldman tonometer, the gold standard, is usually mounted on that microscope when the doctor is examining you head-on with the microscope. And if they're wanting to check the pressure without the microscope, the handheld version called the tonal pen is a nice substitute way of checking the pressure that gives you a digital readout. And there are other methods of air puff, there's dynamic contour, and other ways of measuring the pressure accurately, but the Goldman and the tonal pen are the ones that are the most commonly used in the office. Now, how can we measure your pressure without those instruments, and how can we do it maybe even with you at home? So if we want to get a 24-hour recording of your intraocular pressure, there is a company from Switzerland, Sensimed, that has developed something called the Triggerfish contact lens. And this has built into it, into this soft, disposable contact lens, a strain gauge and a microchip. And this goes right on the eye. The middle of it is clear, so your vision is unaffected. And if you hold a device next to your head, it will actually measure your pressure continuously for a 24-hour period that you have it on. And then when you take it off, it seems to be very well tolerated, no effect to the eye. So this can give you a continuous recording while you're wearing this contact lens. And this is now at the point where it may be available for regular use here in the United States. So if your doctors want to get more information about the variability of pressure, they may actually even suggest using a Triggerfish in the near future. So this is now commercially ready to be used. Another device made by Mesotech from Germany is actually something that's implanted in the eye. The contact lens you have to kind of put on and take off. You can't leave on there forever. This device is meant to be put in and left in. So this is going to be a device that will allow you to have your pressure checked virtually any time, day or night. And there are two versions of it. One is a version that's implanted underneath the outer skin of the eye. And there's another one that's implanted at the time of cataract surgery along with the implant. So there are two different versions that can be implanted in the eye. And again, there is an external device that will be able to record the pressure. Anytime you place that device next to the eye, it will give you an instantaneous reading. So you can do this at home. You don't require any physician or require an office visit. You will be able to measure the pressure on your own. This is a tracing showing in an animal eye the implantation of the device and the recording you receive. You see that it goes kind of up and down a little bit. And you say, gee, it doesn't appear to be the same all the time. Well, this is exquisitely sensitive to the cardiac beat. So when your heart pumps, systole, the pressure goes up because blood is rushing through our body. And diastole, when the heart is not beating, the pressure goes down. And that's actually that's reality. Our pressure goes up and down a little bit with each cardiac cycle. And you see a big blip there, and that's where the investigator pushed on the rabbit eye and raised the pressure by pushing on the eye directly, and let go, and then the pressure dropped back down. So this seems to be an incredibly accurate way of measuring the pressure that seems to conform very closely to the gold standard, the Goldman applanation tonometer. So if you compare the two, the reading from this Mesotech intraocular sensor compared to the Goldman applanation tonometer, it's within 2 points, roughly, of the gold standard. You say 2 points, is that accurate? That's very accurate by our standards in measuring intraocular pressure. This is one of the first patients in Europe that had one implanted at the time of cataract surgery. And these recordings were taken over a 6-month period of time. And then also compared with in-office visits of intraocular pressure. And it gives you a range. It gives you the highest level when the patient was checking 3 times a day, every day at home. And then compared to the office, you'll see the green there is showing the upper limit of the pressures measured over time, and the purple line there is showing the lower limit. So you can see that even on a daily basis there's a range, but also over long term you can see the fluctuation of pressure. So this is, to me as a physician, this is extraordinarily exciting, giving us a wealth of data. This is going to give us numbers that we've really been lacking. We're really going to find out what the highest pressure is during the course of the day without having you in the office directly. We're also going to get information about the fluctuation and see if that's critically important independently of the highest pressure. So 2 different pieces of information, the highest and the variability. It may mean that you will see the doctor less. And I assume that most of you enjoy seeing your doctor, but the hassles of driving to the doctor and getting into the office and sitting there, it'd be nice if the visits were kind of spaced a little bit farther apart if you're generating the information they want and they have access to. You're probably going to have adjustments in therapy much quicker based on having this information. So if the pressures are not what the doctor would like to see, he'll be able to access that information, because this is going to be centralized information the way we see it, especially from the device you wear at home, that the doctors will be able to access that information on a regular basis and make adjustments in therapy probably earlier than they would if they were depending on office visits. As well as really finding out whether you're truly taking medication. Unfortunately, all of us, myself included, can be non-adherent, not compliant with using medication. So missing doses of medication. How often do we miss it? Are we missing it frequently? How high does the pressure go when we miss it? Unfortunately, we're always kind of motivated to take our medications right before seeing the doctor because we realize there's a visit tomorrow. I better take it today. I better take it the day of the visit to make sure I get a good report. Well, that's great, but what happens the rest of the time? And that information we can capture with some of these devices. And then finally, it gives you more of a role in your care. We all want to be involved in our own decision making as well as some kind of input in how we're doing. And I think this puts kind of the patient right in the driver's seat in terms of seeing the information, understanding what the pressures are during the course of the day without actually have to be sitting in front of the doctor and having them check it. So I think this is a very exciting new technological advancement for us in the medical field, and it'll probably revolutionize how we care for glaucoma patients in the future. Thank you. Sure, any questions? Yes, ma'am. Good question. I think, the question is whether you can use this device in one or both eyes. I mean, technically you could do it in both. I mean, some people might do it in one. I think if you have the surgical implanted, you'd have to do implantation in two. The contact lens, you can use it perhaps in one eye or both. You could, theoretically. You could use it in one eye and get the measurements one day and put in the other eye, not the same one, but a different contact in the other eye and do the measurement on a different day. Any other questions? Thank you.